Hi, everyone. I have a special guest today. Meet Dante. This is Dante, my new rescue. I just got him, gosh, it's just under a week now, and he's totally settled in. And he's going to be live with Dr. Corey Counter, who is a holistic veterinarian. And we're going to talk about all things dog, how to take care of your dog, what to feed your dog, how to do a physical examination on your dog. So this is going to be, honestly, this is going to be one of my favorite IG lives because there's nothing that I love more than dogs. So I'm really, really excited to have Dante on the show today and also have Dr. Corey Counter on the show today. So we'll just wait for Dr. Tori to join us. And Dante, you're getting compliments. Here we go. Let's get Dr. Tori Counter live with us. She's joining us right now. Okay. Hi.
Hi.
Hi, Ollie.
How are you? Oh, Dante. Oh, sweet Dante. How's he doing?
He's doing so great. He's really adjusting extremely well. I feel like I've known him my whole life. He's like, it's amazing when this is my first time rescuing a dog, doing a adoption. So,
Yeah.
it was an interesting journey, but it worked out really, really well.
Mhm.
I think
Yeah.
he's sleeping on the job. It's because he stays awake all the time looking for my every move, so he gets tired.
Right, exactly. It's a tiring job, exactly. Well, I'm so glad you guys are settling in well. It does take a little bit of time for them to gain confidence and figure out each
Yeah.
other's, patterns and everything. So that's great that he's doing well.
Awesome. It's so ironic that I asked you to join me here because I didn't even have a rescue at the time when I wanted to do this with you. And then
Right.
it just so happened so fast. And so I'm really excited to have you here today. For the first time ever in a long time, and this is, our four-legged friend companions is the first time that the shelters are empty.
It's
And
amazing. Yeah.
so this is a good time for dogs.
It
And
is. Yeah, that's a silver lining for sure through
it's
all
the
of it.
silver lining. And also, what's happening in China with the ban on, dog meat trade. So
Exactly.
it's all amazing in that way. So, we have to be, there is this, I love it, what you said, it's a silver lining,
Yeah.
100%. So
Yeah.
I wanted to ask you a few questions here, and I know maybe we could start off with. I know you did that amazing physical examination on your Instagram. If anybody's not following Dr. Tori and you have a dog, you must follow her. She has so many great tips, but we're gonna do it all today live on this channel. So let's start off by how do we give our dog a physical examination at home
Yeah.
to make sure that they're okay? People
Right.
like me that are constantly worried, are they breathing okay?
Well,
I
yeah, and
have
it's
to tell everybody the story behind you though before you start.
sure.
So Dr. Tori, I had a very sick Yorkshire Terrier, Mimi, and I called Tori and she came home and gave Mimi an acupuncture session to just get her out of pain. And it made such a huge difference. And so we've kept in touch since then. So Dr. Tori's been Mimi's vet, and now you've got a new patient.
Yes. Sweet Dante. Yeah, I'm so excited for you. I'm always just so happy when dogs come into your life when they're meant to be, when they're supposed to be, and there's a mourning
Totally.
process. So
There
I'm
is,
just
there is.
happy. Yeah, you and Dante found each other. But it's so important right now, especially to really like know your dog's normal, going back to the basics. A lot of people are
Okay.
like, oh, it's like, oh, I have an ear infection, but since vets, some of them are only seeing emergency cases, and a lot of
Yeah.
people obviously don't want to go out right now. So yeah, so starting with a basic physical exam, what I do is I do it systematically so I don't forget anything. So I go nose to tail. So
Okay.
so looking at your dog, touching their nose, there's no every dog has their own normal. So Ollie, his is like a little bit warm and it's wet. His is usually always like that. My French Bulldog, his is always dry and sometimes warm and kind of crusty, but that's his normal. So, just again, knowing your dog's normal.
So his is since I got him, his is really runny. And so the vet I took him to said he could have like a rhinitis and allergies, and he like does that backward sneezing
Yes,
thing
it's
as
allergy
well.
season. Yeah, it's allergy season right now. So a lot of dogs are doing that reverse sneeze, and it kind of sounds like a snort.
Yeah.
So if your dogs are doing that, yeah. Again, it could be allergies, just adjusting to your own backyard, and you have grass in
Yes.
your backyard, he's rolling around. So yeah, but if it becomes like thick or dischargey, but yeah, again, that's his kind of normal for right now. So if it changes, then
Okay.
you know that something is changing.
Okay.
And then, of course, I'm going to try and do this so you guys can see, but looking at the mouth,
Okay.
looking at the teeth, this is super important. And also just to get them used to you, like playing with their face and playing with their mouth. So is there tartar?
Yeah.
Dogs don't have the best breath, but has it changed from day to day? Ollie definitely has some tartar back here, which is,
Do you go all the way to the back as well?
yeah, all the way to the
Okay,
back.
all the back. Okay.
And
Okay, his are
also,
quite good. Just a little bit of tartar on the side, on the front ones.
yeah,
Oops,
yeah.
sorry.
And then just, I mean, if you can, looking in like the top, like the roof of their mouth and their
Okay.
tongue too. Because I've seen
Okay.
a lot of like sticks get stuck in there,
Oh,
lacerations,
wow. Okay.
like ulcers. So, and when you're like, if they're drooling a lot or they're not wanting to eat, then you can take a look in their mouth and say, okay, it's normal. Oh, there's like a stick stuck in there. So that's something else to look for. And their gum color.
Right.
So all these are pigmented, which you can see it's kind of black, but you can see a little bit of
Yes, yes,
a
yes. I
little
can
bit of
see.
pink in there. So their gums, if they're not pigmented, they should be like nice and pink like ours,
Right.
So if they're ever,
Is
yeah,
that normal then? Yeah.
it's
That's nice and
normal.
pink.
Yeah.
Totally normal.
And so when dogs are having an emergency or they're feeling off, and I've been doing these virtual consults with my clients and saying, okay, let's look at their gum colors. Like, are they nice and pink? Okay, great. If they are, that's a good sign. But if they're a little bit pale or a little bit blue or just like a little bit muddy looking, then that's something that could determine, okay, this is an emergency. We got to go to the vet, or he's fine for now. But making sure they're nice and pink.
Yeah.
And then it's allergy season, so you always want to like take a look inside their ears and also take a smell. I know that sounds crazy.
Oh, I know. I used to smell my Yorkie's ears. She used to get infections all the time. So
Right. Yeah. So it's like if you just kind of take a look at your dog like at least once a week, maybe twice a week, and like you start to smell and like one ear smells like a little bit it's so hard to explain. It's such a distinct
It's a distinct smell, yeah. It's kind of
Yeah.
like a little bit like gone bad cheese.
Oh, totally. Because it's like yeasty.
It's yeast, yeah.
Yeah. So it's like if you can smell it and if you
smells
can
good.
just like start to clean them out before it becomes like a raging infection, then you've just minimized damage to the ear, having to go to the vet, having to go on any antibiotics. So if we can like clean those out with like an ear cleaner, or just make sure that it doesn't like blow into a huge infection, that can be huge.
How do you clean them? What do you use to clean them?
So there are a lot of just plain like ear cleaners that you can get over the counter. If they're prone to infections, you probably have some ear cleaner, either from your veterinarian or from past incidences before. And so what I do, what's easiest for me, if you're just one person, you take a cotton ball, you squeeze the ear cleaner on it. You take the cotton ball and you squish it around in there. And then you wipe out and see kind of what comes out. Don't use a Q-tip. Don't use anything harsh like a paper towel.
Good to know.
You can also do like half and half apple cider vinegar and water.
That's what I was going to ask. Yes.
Yeah,
If you
so
can make something at home, I was using apple cider vinegar and water. Make sure you dilute it because it is still a weak acid. It will still sting them a bit.
exactly. And if you look and there's kind of like sores or
Yeah.
kind of, you don't want to use that in there.
Okay.
But yeah, just for cleaning it out. And again, I find it's more comfortable for the dog and also easier on the person trying to clean the ears of soaking that cotton ball and wiping out versus kind of like squeezing liquid into their ear.
Why do they get these yeasty? Is it from the food that they're eating, or is it their constitution, or?
It's all of the above. In general terms, it's basically due to allergies, and whether that's environmental allergies. Again, it's springtime in Southern California right now, everything's blooming. Or if it's year round, then it could be food allergies. So
Okay.
most of the time, the dogs that I've seen, again, I'm in Southern California, most of the time it is seasonal allergies. So grasses, pollens, even if you're inside all the time, it could be dust mites. Pollens come in from the window. So really trying to either pinpoint what's going on. You can do, allergy testing if it's really bad, or supporting them with good nutritious food, omega-3s, vitamin E, again, just like smelling the ears and looking over your dog's body, like, are they chewing their paws? If they are, there's some really good wipes, or again, apple cider vinegar diluted with water. You can spray on there, or you can do like a little bit of a soak.
Okay, that's a great idea.
Yeah, even colloidal silver. I know there's some sprays that I've been spraying on their paws just because it's antibacterial, antifungal.
Perfect. Good idea, especially if you've taken them for a walk outside.
Exactly.
And you want to clean their paws. That's a good idea because just cleaning it with water is not going to get rid of any kind of bacteria or
no, yeah, exactly. And so that's why I say either, wipe their coat down to get all the pollens and allergens after coming in from outside, with a canine wipe, a baby wipe, if that's all you have at home, or again, kind of like that dilution of the apple cider vinegar and water, just wiping down their coat, wiping between their paws, just to get the allergens off. If they are super itchy, then adding in fish oil, which is super important, those omega-3s to decrease inflammation, vitamin E. You can also, depending, again, talk to your veterinarian before you do any of this, but olive leaf extract is really good because it's antifungal, antibacterial.
Oral or topically?
Oral.
Oral. Oh, wow. Okay, that's great because that would really, because this is what we do in humans. So what you're saying to do in dogs is what I do in humans. And they're pretty much, they're similar to us in the sense that, but of course I agree. Always talk to your vet, and you do virtual consultations, which is great. So if anyone wants to reach out to you, they can.
Yeah.
Okay. So then, sorry, go on.
So then, kind of moving on from your physical exam,
yes,
they have lymph nodes right here. They're called mandibular lymph nodes underneath the jaw, so you can feel them. They also have salivary glands right there. So, and you're supposed to feel both of them. So if they're super enlarged, it's just a good kind of like, okay, they're pea-sized, or they feel like, a little bit bigger. But if you just kind of check those, and they can enlarge due to ear infections, tooth, like dental, like oral issues as well. Or we can catch lymphoma, semi on the early side if people are really checking these lymph nodes right here.
So you looking for something, you're looking bilateral. So you're trying to do the difference between the right and the left.
Yes.
And then smooth and okay.
And for now, it's just like, okay, these are the size of Dante's lymph nodes, underneath the mandible, underneath that jawline right here. And so if you kind of keep checking and all of a sudden one day they're enlarged, then you can kind of pick up on things earlier. Okay, is his ears? Is there something going on with his mouth? Is something else going on? So, yeah.
Could they be inflamed if he's got allergies too?
Oh yeah, for sure.
Yeah, because they're a bit inflamed, and it's because I think of the allergies.
Yes, yeah.
He's been getting a physical examination every day. If you know me, type A mommy.
You also want to look at their eyes, make sure their
Yeah.
pupils are symmetric. If they have, you know, gunk coming out of them, is it green? Is it white? A lot of dogs, like, you know, Ollie just has a little bit of tearing that I have to wipe out every
Okay.
couple of days. During
Yeah.
allergy season, that will
Right.
definitely increase if they have allergies. So just looking for that. And then running your hands along, you know, from head to tail along their body, feel their coat. Are there any bumps? Are there any lumps? This is a really great way to find any lumps or bumps or growths before they get to be a big problem.
Right. And
So,
no pain. And they would wince if they felt anything.
exactly. Yeah. And it's a little bit hard to do, but yeah, just like you were doing, kind of running your
All the
fingers
way down.
along the spine on either side of the spine. And they should be, this is, you know, Ollie should be standing for this, but just along the spine, and just to feel, is there any back pain? Are they wincing? Yeah, exactly. You know, and again, we're just kind of going through, this is a great way to just find your dog's normal. It's like, okay, like he's kind of sore in his mid back, or he's never been sore.
Right.
That's been kind of weird today, and he's sore, you know, on his back. Also just kind of moving their joints and limbs up and down, making sure you don't feel any, like, it's called like crinkliness or like popping, or that they
Yeah.
are able to flex and extend their elbow, their wrist, that type of thing.
Are
And
certain dogs more prone to those kind of issues, those joint issues?
definitely like bulldogs, dachshunds, basset
Okay.
hounds are definitely prone to that. Dogs like corgis with long backs. Small dogs are more prone to like knee issues. And
Subluxations of the knees.
yeah,
Yeah.
like, yeah. So if your dog skips every once in a while, they probably have the
Ah,
knee cap popping in and out. So you
right.
definitely want to flex and extend front legs, back legs, see how they do. Now that there's a lot of, like, you know, mixed breeds out there, it's hard to say, oh, these breeds are more prone to, you know, certain issues. But Ollie always jumps off my bed every single morning at like full
Same
speed.
here.
And I'm so worried about his little wrist, so I've tried to get him to stop. I try to lift him off, but sometimes, you know, sometimes they're going to do what they weren't going to do.
So just
you know,
preventing them from jumping off as much as possible.
exactly.
Like trying to get them off the bed yourself first so
Yeah.
that they don't jump off. Okay.
Exactly.
That's something that I've been trying to do, but he likes to jump from pillar to post.
Right. Yeah. And so, you know, I tell my clients, like, it's
Yeah.
not going to be perfect, but if you can just help them a little bit, then great. And then also their tail, lifting their tail up and down, back and forth, making sure, you know, there's no issues. And then you can look at their little bum that way too, and just make sure, you know, there's no swelling around there. There's no kind of hair that, you know, fecal matter can get stuck to, that type of thing.
Yes, that's true.
And then, of
Sorry.
course, yeah.
He's like, what are you doing to me? This
I
is
know.
not what I signed up for.
I know,
Sorry,
poor Ollie
Dante.
during this quarantine. He's
Oh,
been
Ollie,
like
he's honestly the best physical examination model.
I'm very, very lucky because my French bulldog would not have any of this. But
I-
also, you know, looking at their tummies. My husband just a month ago learned that male dogs have nipples. So I
Yes.
realized that not everybody knew
He's
that
got
male
some
dogs
here.
have-
Oops, sorry, baby. He's got some here. Yeah. He
Yeah.
got one on the.
So yeah, I've had people say, oh my gosh, it's a tick, it's a growth. No, male dogs have nipples. So again, that's your dog's normal. So looking at that, again, looking at their genitals, you can kind of look at their belly. But that's, you know, the basics of the physical exam of just knowing what's normal for your dog. Like, you know, if you find a growth, okay, is it tiny? Is it pea size?
Right.
And next week you check and it's a quarter size. That's something that needs to be.
That's something to watch out.
Exactly.
Now the normal growths that, I mean, I'm not a vet, but you know, I've been around a lot of dogs, and you know, I'm always examining my dog
Yeah.
over the years, and I see that the common thing with dogs is sebaceous glands,
Yeah.
cysts. So is there something, is that related to allergies, or is that something you can treat at home? Is that something you need to treat, or can it get infected?
For me, it really starts with food and what type of food you're feeding. I'm a big proponent of like whole foods cooked food. So that's
Okay.
what I give to my dog. I don't cook very often for my um oh,
I think we have internet connections every now and then.
yeah.
You're back
Sorry.
on.
Yeah. So I really like cooked foods, just food for dogs or Nom Nom Now. That's what I use.
Is
Um,
that company Just Food for Dogs?
yes.
That's what I've been using with him.
It's great because it's it's nutritious food. They have options so you can rotate the proteins and veggies, so they're getting a really
Right.
really good nutrition base. A lot of these kibbles, there are some good kibbles out there, and I understand it can be in terms of cost effectiveness and convenience. It's
Yeah.
easy to do a kibble, but it's really dry. It's really dehydrating. There's not enough, like the fish oils is really big for skin and coat health. So a lot of the time, if we just add back in a little bit of those omega-3s, or we top dress the food with a little bit of steamed veggies and some like a little bit of lean meats, even if they are feeding kibble, it will in 4 to 6 weeks time like really even that out. So it starts with food to and I think that's super important, and I'm just trying to educate my clients on that, and trying to give them whole nutritious food. Again,
Yeah.
even top dressing kibble, that's going to be a lot better than just pure kibble. Or even just like if you give them treats, give them apples, carrots,
Okay.
cucumbers, that type of thing.
Can you give them, okay, so I want to move on. So because we're talking about food and food as being the underlying cause, as a naturopathic doctor, I'm always, food is medicine. So um, we talked about, having kibble. So I'm right now currently mixing kibble with what he was having before. They had a kibble, bison kibble. And I'm mixing it with the Just for Dogs, so which is like meat and vegetables. He's not an eater. He reminds me of the other dog.
Yeah, yeah,
Really,
sometimes, and that's his normal.
it's his normal. So what I do is I take it away, so I don't leave it out all day, so that he knows when I put it out, he's got to eat it.
Yeah.
And I'll mix in like different like the meats and vegetables that Just for Dogs, and I'll meet it. Now, do you recommend pouring hot water with that and mixing it up with a kibble, or is it okay to have it cold? Because I know in humans, I recommend people don't eat cold foods for digestion. Do you
Right.
think
Yeah.
that's
I warm up my dog's food. I put a little bit of warm water in it.
okay?
And that also helps them just get,
Okay.
more hydration as well.
Right.
If dogs don't love their kibble, if they're having a hard time eating, you can also do
Yeah.
like a little bit of bone broth or vegetable broth.
Good idea.
Just make sure it's not like heavy
Salted.
in onions and stuff, but like it'll
Right.
smell really good. And I mean, the benefits of bone broth.
Yes.
And same as dogs, same as pets.
I didn't even think of that. That's a
Yeah.
brilliant idea.
And also now that it's getting a little bit warmer out, I put bone broth in ice cube trays. And so after like for a treat of being outside, you can just give them an ice cube. I'm lucky my dogs do like ice cubes. Some dogs don't, but that's another fun treat to give them,
Yes.
hydrating them, giving them the nutrients in there. And you're doing exactly what I would say all new dogs, or when you're transitioning from one food to the other, is do what they were on before and slowly transition to the new food, because you don't want to upset their stomach. You want to get them used to it. So I always say, do it over at least 7 to 10 days to make sure that it agrees.
Okay. Okay. And you can keep the kibble in there because the kibble is good for their teeth, right?
Yeah, there's so much debate on that.
Okay.
I think it's good for like like the chewing, because my dogs are chewers. They want to chew things.
Right.
They have those big carnassials back there, and so yes and no. I don't think it takes the place of teeth brushing or trying to like get that food stuff off of there.
Yes.
So some kibble will kind of stick up into the gums and on the teeth, but so again, it doesn't take the place of teeth brushing, but I think it helps with that chewing sensation that they want to do, and that crunching sensation.
How many times do you need to brush your dog's teeth?
Ideally 3 to 4 times a week.
Wow.
To be honest, I know I have to be honest with my dogs. I get it twice a week, and that's like a huge win for me.
Okay, because they don't love it.
Yeah, and that's the hard thing is that, you know, with some of these dogs, again, you're getting Dante a little bit older and he may
Yeah.
hate it and it's a huge learning curve. So if you guys have puppies, start there.
Okay.
So again, like the crunching and some like the bully sticks and there's some like water additives that you can give, but I don't absolutely love that. But it's just trying to get them used to you looking in their mouth, brushing, even if it's just for like 20 seconds twice a
Right.
week. Fantastic.
And okay. And so also like getting things like these things, like these greenies. What do you think of these? These
Um,
natural dental treats.
Yeah, as long as they're like natural, made in the USA versus China, as long as
Okay.
you are watching them chew them, and because some
Okay.
dogs will like swallow them whole, and
Oh
then
dear.
yeah.
Okay.
So as long as you just kind of watch Dante, make sure that he's doing it appropriately. Maybe he eats part of it, you take it away and give it to him again, you know, a couple hours later, then that's good. And again, that's helping get that tartar off of the teeth.
This is gluten free. What do you, so you know me, I'm all about gluten free, and I've even got a face called gluten face. I don't know what a dog's face, maybe we could make up 4 faces of dogs, gluten, dairy, sugar, and I mean, I don't think Dante is going to
Wine.
sip on some wine,
Yeah.
right? But like,
Hopefully not. Yeah.
we could do like 4 faces of dogs, like what things happen when they have, you know, gluten face and, you know, what happens with gluten. So is gluten a really big thing for dogs? Because it is for humans in terms of intestinal permeability issues.
And totally. And, you know, unfortunately, the research is lacking on a lot of
Okay.
dog specific and cat specific good nutrition and details because obviously it's just funding issues. That's a whole other topic. But
What's your experience? Like, what's your experience?
my
Personal
experience
experience.
is like a well balanced, sure, gluten free, but they also need a lot of people take that as grain free and they need grains and they need good meat and you know the building blocks of meat are the amino acid
Okay.
and a lot of companies now are if they are grain free or you know gluten free then they're you know decreasing the amount of carbs in there and then they're substituting animal protein for legumes, you know, lentils, peas, that sort of thing. And we're
Right.
seeing a link with that and DCM, which is a cardiac disease in dogs.
That's what I heard.
Yeah.
So
So
the grain free is not the way to go.
the grain, I tell my clients if you're going to do kibble, do grain inclusive kibble. There
Okay.
are some like the fresh foods or some really quality foods out there. They use animal protein for the recommended amount or for the percentage of protein, and they don't kind of skimp out on that protein and use like a lentil instead. So there's still the FDA and like Tufts University, they're still doing a lot of research on what exactly is causing the DCM. Is it that switch, you know, from lower meat or lower animal protein to the lentils? So, you know, some of the nom nom nows that I feed my dog and the Just Food for Dogs, no, they don't technically have any grains in it, but their meat source or their protein source is the what they should be getting from the animal protein.
There
So,
might be a fiber connection to that.
oh, for sure. Yeah. And
Like
also
something to
like
do because we know fiber is super important in humans for
especially for the gut
cardiovascular
bacteria. Yeah.
and the gut bacteria because it feeds those short chain fatty acids.
Yeah.
And there's a short chain fatty acid in the gut that's called butyrate that's actually protective and it increases colonic epithelial cell activity. So it's interesting, you know, there's and you know, this is the recent research, right? This is something very new that we're finding out.
Extremely new within the past, I guess it's been 2 years now. So, and there's
Yeah.
still, they still don't have a concrete answer. And so us as
Right.
vets we're trying to give the best advice and give the best food advice. So I say, you know, fresh whole foods or raw foods or grain
Okay.
inclusive kibble. I love a probiotic. I love the fish oil, you know, and a joint supplement. Those are what I recommend as like the basis of what you should give your dogs on a daily basis. So
Now, human probiotics versus, so of course, I created a probiotic for humans. Now, dogs are going to have different probiotics for their digestive system. How do they differ from us? Like, what is their unique characteristics for their gut? Like, how are they, what do they need a different kind of probiotic? Is there a specific species that you recommend?
Yeah, so Bacillus coagulans is really important in dog gut bacteria, or in dog guts, basically. And there was a study that also Lactobacillus acidophilus is really good, especially with stress diarrhea. So
Okay.
they did some research in shelter situations. A lot of dogs are stressed out, obviously,
Yeah.
and they get diarrhea, and so that Lactobacillus acidophilus is super important in dogs. For, with a gut mind connection for anxious dogs, behavior issues, there has been some research with Bifidobacterium longum, which shows that after 4 to 6 weeks of consistent giving that specific bacteria, that their anxiety turns down a notch. They're better at behavior, they're better at training. So that's huge. But that said, like, if you, again, we're in quarantine, if all you have is your own human probiotic, I say, something is better than nothing. So if you have a small dog, give like half of the recommended dose.
Okay.
Big dog, give a full recommended dose. But
Are there any adverse effects that you should look out for them being on probiotics?
a little bit of like bloating, some gas.
Okay.
If that happens, just back up a little bit.
Yeah. I'm going to
Yeah.
give him some of mine because when I got him, he was put on antibiotics.
Yeah.
Because they thought that he had an upper respiratory tract infection. Really, it was just allergies.
Yeah.
So I took him off. I called the vet and said, I'm taking him off. And they're like, fine. And so I was going to ask you today, but I took him off because I didn't want him to stay on antibiotics.
Yeah.
If he didn't need to.
Mm-hmm. Yeah.
So probiotic, that is so interesting. The stress connection with the probiotics. There's a lot of research with humans and probiotics and stress. So it's again super similar. What do you think of these ones here? These are the raw alternative to rawhide. What do you think of these type of things? They don't have rawhide in them. I don't know what it is actually, to be honest. I don't even know what I'm looking at here, but it just says that is rawhide bad for dogs?
I like it to be sourced, hopefully if it's like from the US.
Yes.
Again, this goes for treats as well, like organic and as little ingredients as possible.
Okay,
So
that's good to know.
Yeah, and a couple of months ago, there was with the pig ear, kind of like rawhide, there was some information. And unfortunately, there's always with our food system the way it is, there's always something. So, just being on top of like, okay, like pig ears, like let's hold off on that for a little bit. But again, like the chewing versus, destroying your house and also just keeping Dante's teeth clean. You want to make sure that, again, they're not swallowing it whole. But as long as there is, simple ingredients, organic, made in the US, at this point, I think it's great.
Now, right now, everybody's talking about one thing and one thing only, pretty much, is the COVID-19 disease.
Right.
Can you tell me, can dogs get COVID-19? Are they able to contract it, or are you able to contract it from them?
At this point in time, they have not come down with the illness. So there have been a couple of dogs in households with owners and humans that have been positive and severely infected. They have tested positive. None of the canines have come down with the respiratory symptoms, no fevers, nothing of the illness. There are a couple of cats in New York City, again, where there was just, a heavy COVID outbreak where they came down with the respiratory signs, but they're expected to make a full recovery. And, the tiger do as well.
Interesting.
But in theory, I think there would be a lot more sick animals if it was very, very easily transmissible.
Fair enough.
Yeah.
Fair enough. Or maybe they get a mild version of it and it's undetected type
Exactly.
thing.
Things may change, things may mutate, but that's, for now what's going on. But if you take Dante out for a walk, and I know this is not happening now, but if people are petting him and all that, then I would wipe him down, give him a bath, wash the collar, wash the leashes, just like you're doing with yourself, washing your hands, washing your clothes, just making sure that they're not going to be more of like a fomite or just transmitting the virus. But I think that's very, very small risk at this point.
Okay. So we've talked about food, we've talked about supplements. So we're really big on fish oils, the omega-3s. It's anti-inflammatory.
Hmm.
It's super good for dog heart health. It's good
Yeah.
for, their vision. It's good for lowering overall inflammation. And then you talked about probiotics, the lactobacillus and the bifidobacterium. Super, super good for their gut. Also their stress levels, helping with diarrhea. Um, is there anything else? Any other stuff? You talked about olive leaf extract if they've got some fungal, but of course, that's where a consultation with you would go really well. And then you'd be
Yeah.
able to prescribe what botanical or what vitamin um, that dog should be taking. Do you do consults people from all over the world? Because I know I have a lot of people here from the UK that are listening. I have a lot of, I used to live in the UK, so we've got, is it just the US? Is it just California? Are you able to do dog consults via virtual
Yeah,
to
so
advise?
the laws are a little bit tricky in veterinary medicine.
Yes.
They don't quite match up with human. So I can do what we
Okay.
call tele-advice. So I can help guide you in the right direction. We can talk about nutrition. We can talk about some supplements, but I cannot prescribe or diagnose. But I'm also, I work with a lot of people's regular veterinarians, and we kind of come up with
Perfect.
a plan together. So that's really,
That would be perfect. Yeah, because that would be perfect. You could give advice, you could dialogue with their vet
yeah.
somewhere in the UK or elsewhere in the world, and then they could get the holistic approach because I think that's super important.
I do too, but there's a
Dogs
place
do so
for
well.
both. Yeah.
And well, I think it's absolutely necessary. I know homeopathics as well. I know I gave Dante arnica when he had his neutering surgery, and when we took him in for just a quick checkup, didn't need to, but I wanted to check. And I knew everything because I hadn't met the dog yet. So
Yeah.
we sent him back in, and the vet was shocked at how he had recovered. He's like, this is impossible that he's had surgery. How is it? He's recovered so well. So
Yeah.
things like arnica really
Yeah.
are game changers
They
for
are.
any kind of
Yeah.
surgery. Or do you see that as well? Because you must see a lot of dogs post surgery.
Yeah, I do see that. Arnica is a little bit, you need to give it in small doses because they can get a really bad like GI upset, and they're just they're more sensitive to it than humans are. So again,
For
just like,
homeopathic? Oh,
yeah.
wow. Okay, that's good to know.
But topically, you can kind of put it on the surgery site, or not on open wounds, but just areas of pain, and make
Okay.
sure that they don't lick it off. And that's huge. That's wonderful. But yeah, I've definitely seen that. Quercetin is great for like allergy season, cancer, and just helping work holistically. From Western, Eastern, natural medicine. That's great. But yeah, arnica is great. Again, talk to your vet before administering it. Um, Boswellia also for
Right.
osteoarthritis. That's been really great. For anxious dogs, diffusing lavender or frankincense in the room can just help turn down their anxiety. Rescue remedy, anybody can find that in like, co-op, Whole Foods, it's everywhere. That
Yes, I
helps with
just got
anxiety.
some
Yeah. So,
rescue remedies and not, it's a lifesaver. And you can just rub it on their fur as well, right? If they
um,
won't take it.
yeah, you can rub it on their fur, you can put it in their water source, but sometimes dogs don't drink, right away. So that's a little bit more difficult. And then, yeah, Boswellia, but just kind of tweaking again their diet and adding in these herbal remedies and natural sources, it can be a game changer. They can recover quickly. They can, pop back from surgery a lot quicker than previously, without any of these interventions.
I had no idea that arnica could cause stomach upset. That's really interesting.
Yeah. So, but again, it's probably dog dependent. And just,
Right,
and you also know how much to give. And a lot of people
right,
are going online and just kind of giving a dose. And so
right.
that's where we really need to have a dialogue, with people of what's the proper dose.
100%,
Yeah.
100%. I couldn't agree more. Now, we talked about what to feed dogs. What should we not give them?
um, Caffeine, chocolate, grapes, raisins, macadamia nuts, anything that they could like, like peaches with the pit in it. I know that's common sense, but you would be surprised at how many dogs I've
Yeah.
seen with like a peach pit or like an avocado pit stuck in their intestines. So,
Is
you know,
it grapes because of the seeds, or what is it about grapes?
they it's difficult to actually understand cause kidney failure basically in dogs, but
Okay.
it's really dog dependent and they don't know, is it one grape, is it 50 grapes, with caffeine we know like
Uh,
the milligram per pound and
yeah.
all of that, but so
And chocolate for sure. Yeah,
yeah,
absolutely not.
exactly, yeah.
Is it the what is it called that's in there? The
Theobromine.
hemobroma. That's what it
Yeah.
is. Yeah.
So it can cause like heart palpitations, obviously like stomach upset. And even if they recover, we have to we have to look at the pancreas. So pancreatitis. So with fatty foods. So if you're giving a lot of salmon for the first time, if they got some food that had like a lot of gravy or fatty substances that they're not used to, that could cause like a flare up, inflammation of the pancreas, a pancreatitis, which can then cause further issues, systemic issues. So,
So what if a dog gets into chocolate or gets into your garbage can right now, and it's this time where you don't want to leave the house for any reason? What do
yeah,
you do if your dog has consumed something and you're not
something.
100% sure, or he's consumed, leftovers and is just feeling really sorry for himself, not feeling good, not acting himself? What would you do? Would you is this something where they could contact yourself or contact their vet, or do you just keep them
Yeah.
away from food and water? Like, what is the procedure for this?
So, again, it's very case dependent, but I
Yeah.
would say call your vet. Many vets are open and they're willing
Okay.
to have a dialogue with you of like, okay, how much does he weigh and how much chocolate did
Right.
he eat? Is it milk chocolate? Is it dark chocolate? And they can
Right.
walk you through that. There's also poison control. So if something major happens, you can call poison control. If they just got into your garbage, that that's a little bit more difficult, or if they ate like
I don't know.
like one client called me because her dog ate a chicken breast, like a whole chicken breast off the counter, a small dog, and I said, you can either probably just like watch him for 24 hours.
Yeah.
Again, I know this dog, so I kind of know how he acts, but watch him for 24 hours. I didn't have them feed dinner. If there's any like vomiting, diarrhea, that type of thing, if it goes on further than like 24 hours, to take him in, watch for loose stools. For breakfast the next morning, I said feed half of the breakfast. You could even do like a little bit of rice, a little bit of bland food, just to kind of help with any GI upset. And also, just to make sure that after 24 hours, they're doing okay. If they're not, then I would take them to the vet.
Okay, that's good. That's super good advice. I'm trying to think, have we forgotten anything, Dr. Tori? Is there anything else you wanted to add?
Yeah, like fish oils, probiotics, joint supplements are great, just to prevent
Okay.
or decrease osteoarthritis and joint pain. Again, with Ollie and with Dante just jumping off the bed, like I know that Ollie's going to get some sort of arthritis in his little carpals. Um, yeah, and just there's something, I just want to tell people that like you can you can prevent a lot of things from food and supplements, and also catching things early. So just taking a look at your dog or taking a look at their ears, so that again they don't have a blow up ear infection and they have
Sure.
to go on antibiotics and all of that. So
It's such good advice, and it's such, easy things that you can actually do at home
right.
to prevent, taking your dog to the vet, because you can also overdo it if you're,
Oh yeah.
getting them on medication all the time, and even things like you said, quercetin. That was a good, I didn't realize dogs could take oral quercetin, because I know it stabilizes mast cell formation, so
Right.
prevents allergies. So that's something I'm going to be definitely going to get for Dante right away, because he has massive allergies. And it's so funny. So do I right now. I've never had allergies before until I moved to Los Angeles.
Yeah.
So
Southern California, it's like, yeah, Southern California is very, it's just like the pollens and whatever. It's allergies.
Interesting.
Yeah.
It's interesting. Well, I hope all you pet owners out there are having fun in the sun with your fur babies and wiping them down when you get home. And, you know, of course, social distancing, avoiding letting people pet your dog. It's so strange because, you know, all these dogs want to play together and they can't. So I'm wondering what the psychological impact to them is, you know, like they're just
Yeah.
like,
Well,
right?
especially with Dante, I know he follows you around, but really trying, I know it's so hard, but trying to separate yourselves, you know, starting with like 20 minutes,
Okay.
30 minutes, just because when you start going, you know, out of the house more, he doesn't freak out that you're not around. So slowly either
Wow.
training him or,
I'm gonna have to figure it out because everywhere I am, he's there. It's like The Shining. Like I'll be in a
yeah.
room and I'll be like, oh, he's there. It's like he's very, you know, and that's why he stays awake all day. He doesn't sleep during the day, so that's why he's so exhausted because he's
Yeah.
so fixated. And these are what happens to. And you gave me that advice, so I am trying. I'm trying to leave him while he's sleeping and go into another room. But as soon as he realizes I'm gone,
It's
he's
right
there.
Yeah.
But I'm gonna see if I can, you know, really. Do you recommend doing it even if they cry? Should I go into my room and shut the door?
I mean,
You know,
I
what?
do. So for Ollie, he has severe separation anxiety, and it's crept back up since I've been home more. So I have a lot of baby gates, even though I don't have any kids around the house. So I'll put up a baby gate, and then I'll go work in the other room. So it's like he can still see me. If he starts to cry, I let him cry a little bit and gain confidence that, you know, you're gonna be back.
Okay.
A lot of dog trainers right now are doing virtual consults, so it's always a good idea. They're like the best
Oh,
fit. So so that's a really good way to kind of help with the progression of the behavior. But yeah, baby gates. If you have a crate and you're trying to crate train, like treats in there, but leave the door open so it's a safe space, that type of thing.
brilliant, brilliant advice. Dr. Tori, as always, it's so good to have you. I hope we can get you on more often. I'm
Yep.
now doing a podcast called Healthy Doc.
Love it.
So you can download it on Spotify. And I think we should do some day, like, you know, like seasonal type talks about, you know, what to do now. It's allergy season, you
Right.
know, because a lot of your advice has always been the advice I've followed, and you're incredible. Thank you so much.
Thank you. This was great, and I loved seeing Dante.
Yes, I will. We'll have to, when you're back in this neck of the woods, we'll have to get together with our dogs.
Yes, for sure.
All right. Take care. Thank you,
Thank
everyone, for
you.
being with us today. Happy Friday.
Bye.